Welcome back to the CashPT Lunch Hour podcast. This is your host, Aaron LeBauer, and today my special guest is Dr. Kaitlin Herzog. Kaitlin is a physical therapist here at our clinic, and she just celebrated her one-year anniversary.
Yay!
Woo! Yay! Audience, what's the audience track?
I don't know.
Okay, so we are going to talk to Kaitlin today for a couple different reasons. One, because she's got a body of knowledge I want to unpack and share with you. Number two, some of the things she's been doing in our clinic are really awesome, and so I want to talk about that. And number three, we're going to talk about what we've been doing to transition our patients to telehealth and video visits this week and how she's been successful. And I think we've had all of our pre-existing patients move into video visits this week, except maybe one, I think.
Yeah.
So we're going to talk about how to do that and how you can do it, as well as how to deliver an effective treatment via video. Mm-hmm. So, Kaitlin,
yes.
Welcome to the show.
Thanks.
This is awesome. I don't do many in person.
Glad to
of
be here.
these. So this is awesome. I think the last time I did this was with Tyler, Derek, and John.
Oh, wow.
And
John.
You know all of those guys.
I know I'll have to listen to John's now.
Yeah. So tell us a little bit about you. How'd you get into PT, and how'd you end up here?
Okay, so I've been an athlete my whole life. So I did soccer, volleyball, track, softball. I think that's it. But yeah, so throughout high school I had back pain from supposed scoliosis.
Yeah.
From what we know now, who knows if it actually was. But that was my first experience with PT. Then graduated high school, went to college, and I was thinking about doing physician's assistant. But quickly realized I didn't want to over-medicate people. So then I was like, I started powerlifting, got a shoulder injury from powerlifting, and then found myself back in PT, and I was like, oh, I like this is fun, I could see myself doing it. Shadowed a bunch of people, was decent at it, so I was like, okay, this comes easy, let's go to PT school. And I graduated PT school, and kind of was in a mill PT clinic for my ortho rotations. Mm-hmm. And then listened to your podcast, was on your email list, and you were like, hey, I'm hiring. And I was like, okay, we're going to try this. And then here I am now, a year later.
Awesome. So tell me, your dad is a PT or OT? Or?
He's an OT.
He's an OT. Okay.
Yeah.
So is he doing anything similar to what we do?
Kind of. So not now. So he used to be an ergonomic specialist. Mm-hmm. So his job was basically preventing workplace injuries. Mostly in factory workers, mm-hmm. And then if anyone did sustain like a workplace injury, he would just do the rehab on site to save them lots of money. Was
your dad being an OT a reason that you didn't want to do PT early on or anything similar to that? Or did he have any influence on you?
Surprisingly not. It just kind of happened that way. I didn't even think about it. I was like, yeah, that doesn't sound interesting. And then I picked PT. And now we just kind of talk rehab, and it's funny because we both know the same things, but we're like, oh, it's funny the turf war that they have in like skilled nursing where they're like, we get the upper body, and PTs get the lower body, but yeah.
One of my friends, when I was getting started in my career as an OT, and she was like, yeah, we learned how to weave on a loom. Well, in North Carolina, we have a lot of, Cone Mills was here, and so they had to learn how to weave on a loom in order to help their patients who were working in factories weaving on looms.
That's crazy. I'm going to have to ask my dad, did you have to learn how to do assembly line tasks? Because it's crazy. Yeah, so it's task specific. I think PTs could be better at that.
What, let's see, so you are a power lifter. Like, how'd you get into doing that?
So basically, I was a runner. I had to run for soccer. I was not a runner my whole life, and I always hurt when running. So in high school, anytime I would run for soccer, my ankles would hurt really bad. So the PT that I saw at the time before my back just gave me orthotics and was like, here, this will fix the problem. Mm-hmm. And it did temporarily. But now I hurt running for different reasons. But basically, I got into college. That's why I didn't end up doing club soccer. So I was like, well, I want to be fit, but I can't run. What do I do? And one of my guy friends was like, hey, you should just lift weights. It's fun. And that was what didn't hurt, and it was fun, and I felt strong and more like empowered when I was doing it, and I just like fell in love with the feeling of like being strong and taking up space as a female. So we stuck with it. And
how do you take up space as a female?
Ooh, I think the confidence helped me take up more space, because I used to be a lot more shy than I was now, and I would like never say anything. And now I'm a little bit more outgoing, people say, and they're like, oh, you're always so happy, outgoing, and smiling. So I think it just gives you confidence, because you're like, oh, I can deadlift 300 something pounds off the floor. I can do anything.
Right.
And it pushed me outside my comfort zone, which then translated to like in school and life, stepping outside of my comfort zone. And then just taking up space, because just a lot of like the media and society tells females, oh, you need to diet, you need to be skinny, you need to be small, versus you're like building muscle in the gym, so you're like physically also taking up more space.
Right.
Yeah.
Because you can lift a whole lot more than I can.
Maybe.
Well,
I was gonna say, what are your PRs?
That's a long way to lift the weights off the ground for me.
True.
I got a big lever, and there's a lot of distance between my shoulders and hips.
I know, it's crazy. I always hate the people shorter than me that can squat more than me. I'm like, it's not fair. You have shorter femurs.
Right. Well, you did you have a couple records in the Sumo Deadlift or something like that?
Yeah, the Sumo Deadlift, that's was a national record as of like 2 years ago. And then I had the squat, bench, and deadlift state records for New York.
Okay. Is that age, weight class? How do they define the different classes?
Yes.
Because I don't know.
Yeah, age and weight class, and then I set the deadlift one because it was a drug-tested one. So we're all clean. We're a clean athlete.
Cool. So was it sumo or conventional deadlift?
Sumo. So conventional deadlift, when I hadn't done it in like 2 or 3 years.
Yeah.
Before I started my job here. Like all of grad school, I didn't conventional deadlift at all. And then I was like, ooh, I know I should be able to do it, and it'll help my sumo. So I started doing it like 2 weeks before my job interview here, and it hurt my SI really bad. So then I came here, and during my job interview, you and Tyler both treated me for that. Yeah. So that was all sumo. Conventional, I haven't maxed out yet. So I want to do that this year.
Okay, awesome.
I want to hit a triple body weight deadlift this year.
Cool.
So we'll see.
Hell yeah.
Yeah.
I'm just at like a little over body weight.
Oh my gosh, Aaron, we got you. You should try the sumo. You get to move the bar.
I know, you only have to move it a half an inch.
Yeah, exactly.
Even for me, sumo, I gotta move it like half a foot,
Which one do you like better, sumo or conventional?
I don't like sumo as much because my hips don't externally rotate super comfortably. And so I like a regular deadlift, but I prefer kettlebells anyways.
Wait, even though you're like a yogi, I feel like you'd have really good mobility. Interesting.
No. I've got good mobility in flexion, but not hip rotation, hip flexion, because I race bicycles.
Oh,
it's like a good hip flexion, decent hip extension. My hip rotation isn't as great. It's better in the last few years, but it's not like so sumo is uncomfortable for me.
Yeah, that's crazy how much your body adapted to bike racing, because like overhead stuff for you isn't great.
So if you're watching, it's like
it just stops.
Yeah, but it's improved. So one of the things that I did to improve, and I don't know, I haven't figured out how to do this for my lower body yet, but swinging the mace and the weighted the mace and the weighted bell. What's it called? Not the it's a mace and the weighted club.
Oh, the weighted
Doing
club,
that has improved my front rack position this year when a lot of other stuff didn't.
Yeah.
I don't know if you know that, but that's what it was that did that. So I had to figure out how to do it with my legs.
I was like, what's your secret? I don't know. You had to become, what is it, like the monkeys where they can just grab stuff with their feet?
Right.
You just had to be able to grab the club with
stand
your
on my
feet.
hands and just
do that.
Yeah, I will get there one day. So what are you working on right now, like fitness-wise? Just, because, and the reason I ask is, one, I want to know, because I don't get to ask you these questions all the time. And two, it informs your physical therapy practice. So what are you working on now, like fitness-wise? What are your goals? Where are you competing, etc.?
So, well, because of the current craziness, my upcoming meet got moved from the first weekend in April to August, the weekend of my birthday. So I was originally competing in that meet to qualify for American Open Series, which is this huge national competition in Winston. So hopefully they postpone that Winston meet so that can still all happen.
Right.
So that was the plan. But basically over the past year, I switched to Olympic weightlifting to increase my mobility and because it's a lot more fun, I think. Just because it's something besides squat, bench, and deadlift. Because you can just burn yourself out doing squat, bench, and deadlift for 3 years. So eventually, probably at the end of this year, or after American Open is done, I want to start training for a super total meet, which is where you compete squat, bench, deadlift, snatch, and clean and jerk all in the same day.
Okay.
So you just combine both sports.
Oh, wow.
So you have to be really strong and really mobile.
Yeah.
So
Okay.
that is like goals. And then a triple bodyweight deadlift
Cool.
at any time. And then I want to snatch my bodyweight. And I think those are like the top goals.
Yeah. Awesome. How far away are you from that? Couple
Let's
years?
see.
Where are we?
Hopefully within the next year. If I was faithful, I haven't trained deadlift in like a year,
Mm-hmm.
but I feel like my strength would come back relatively better. And I feel like because I've gained better strength in like a high bar squat and conventional deadlift,
Mm-hmm.
I'll come back stronger. So hopefully like by December I should be able to hit that.
Yeah.
We'll see though, because I haven't deadlifted in a really long time. And then I'm like 4 kilos away from hitting a bodyweight snatch.
Nice.
So it's really close.
Oh, yeah. That's awesome.
Yeah.
Very cool. Okay, so back to the physical therapy.
Physical therapy.
This is a physical therapy business podcast.
Physical therapy.
Tell me, when you started working here, what was the easiest thing for you to, to figure out, and what were the things that took you a while to get comfortable with?
Ooh, the easiest thing, I'm not gonna lie, was notes.
Yeah.
They're so much easier than, I would say, the Oasis thing for home health and just all of insurance forms, because I hate those. So that was the easiest thing to hang up. I was like, wow, this is so much more lenient. I would say the hardest thing would be, can I pick 3 hardest things?
Of course.
Okay, so 1 is hands-on manual, because I think in general PT has just strayed a lot, I guess, more away from manual because you don't have the time for it. And like my school didn't really place an emphasis on manual. So they were all about tools, tape, because that's kind of what's more trendy now, I think also. The second part would be assessing for yourself and like not having that like bias over referral. So all the mill PT clinics I would be in, you would get like the referral and it's like, treat them for low back pain. You're going to do all these things. Every low back person gets the same stuff and then they go do the same exercise. But here it's like, okay, I'm actually going to break you apart and see, oh, we actually need to treat your hip for your low back or your T-spine extension rotation for your low back, instead of just, oh, let's just release that QL, scrape it a little bit, and then go do some bird dogs in the corner. But yeah. And then third thing would be more of like that psychological component, because like in the mill PT clinic you don't have time to talk to people, so I didn't really know that much about them or like all the stress in their life and how that like contributes to their pain and their like emotional state.
Right.
So.
All right.
Yeah.
How'd you figure out how to get through all those? Like, what was the thing that got you to get to a point where you're comfortable with those things and delivering?
A lot of it was like putting in the reps. So like the Con Ed that you sent me to, so SFMA, MFR 1 and 2 like helped, but a lot of it was just putting in the reps and practicing with people. And then the more like psychological part of pain, that's still like a work in progress, because it's like you can only do so much as a PT. So sometimes I have had to suggest like people gently referring them out. Some people give a lot of pushback because they don't think they need like mental health services at all. So there's that. And then now we have a bunch of free pain science courses, so we're gonna do those this weekend because PTs are nice people, so they're like, because of COVID, have some free resources. So
right.
I'm excited to dig in deep to that.
Awesome. Any one particular that you're signed up for or looking into or excited about?
So Modern Pain Care, I think is what it's called. They released a free one, so I signed up for that. And then I think it's Jared Maynard through the Clinical Athlete. If you just go to Clinical Athlete, their website, they have a free one too.
Okay. Awesome.
Which is cool.
Yeah.
So get your free CEUs, guys.
Yeah, that's great. So before I move on to a couple things I want to talk about, what has been the biggest, in the last year working here, what's been the biggest insight or aha moment that you've had or thing that you've learned?
Thing that I've learned.
That's made the biggest impact on you as a person or your ability to treat as a physical therapist? Is there like one thing that maybe it's just been 50 of them, but
I was gonna say there's a lot. A lot has happened in a year. I feel like your first year is like a big, whoa, here, welcome to PT, and you learn a lot. No, but I would say honestly, just like listening to people. So I think a lot of times we as PTs like try to fix people, or we come in with what we think the problem is, but usually if you just ask the right questions and like listen enough, the patient will either like tell you what's the problem indirectly and they just don't realize it, or it's like completely different than what you thought the problem was.
Yeah, that's awesome.
Yeah.
What do you want to learn the most in the next year? Like, where do you want to be a year from now?
A year from now? Ooh, I would say more working, I guess, my efficiency. So kind of like having a high-level athlete come into my clinic and they're like, oh, I tweaked this thing while lifting, and then I can just like work on that in one visit and they're good to go. Instead of, because now I'd say I take like 3 probably. But also, I guess, having more tools in my toolbox for the pain science. And then a lot more hand and foot stuff.
Yeah.
Because that's really intricate. So I want to refine those skills.
Awesome. Get your dad to come teach us that in class, right?
I know. That's what I was going to say. I was like, I've been working on asking him, but he just... Yeah.
Awesome. So what's been... well, I'll say this. You're really good at the sales that we do.
Yes.
Right? Because,
that has been a skill.
Yeah.
Getting people to buy in.
Right. What did you have to do to get people to buy in?
Ooh, so a lot of it, again, putting in the reps, but also like making people, I guess, not even uncomfortable, but you like have to be okay with being uncomfortable with them. So a lot of times you'll ask questions that people like don't have the answers to, and people get uncomfortable when they don't have the answers. And also people really don't like silence, but they kind of have to sit with the silence so they can actually think of what the answer is and then be able to tell you. And also, once again, like listening to people and helping them realize what they actually want. Because a lot of people think, oh, I just want pain-free. And it's like, well, no, if they only want pain-free and you get them pain-free, I don't know, say in like 3 visits, but you haven't fixed the problem, they still need to keep coming so you can fix the problem. And you need them to like see that. That way they do buy in and keep coming for their whole like plan of care.
Right. So what's the number one way you get buy-in from patients for that?
Buy-in? I would say usually like the before and after results of just like the top tier of the SFMA, because that's something like tangible that they like see and understand.
Right. So like doing it before you treat them and doing it quickly afterwards.
Yeah, and then also like constantly reminding them of their goals, which is something I kind of got from Paul Goff, because he's always just like, they might be out of pain in like 3 visits, but say you need them to come for 8, and it's like, oh, like you said you wanted to, you know, PR your mile time. Well, if you keep coming, we can do that. If you just quit now, you're not going to PR your mile time, and you told me in the beginning that's what you really wanted. Right. Not just pain.
Yeah, absolutely. What's the number one question you ask people to get them to give you that information? That they don't just want pain relief, but they want to be able to PR their lift or triple body weight, their snatch, or whatever.
So this is something I did get from my dad, which is funny. So people hate it, and I always hated this when my dad did it to me growing up, but you just have to be like, why? Or tell me more. So they'll be like, I just want to feel better. Well, why do you want to feel better? And a lot of people don't even know why, and then you just keep like prodding them, and they'll be like, oh, I want to feel better so I can like be a better mom. Okay, well, like, why do you want to be a better mom? And then that's how you kind of get to the like more emotional reasons, because a lot of people also, they'll have like performance-based goals, but they're not actually really that motivated to do the performance-based goals. So you kind of have to figure out why, like emotionally, why they have that goal.
Right.
So a lot of them, it's like, I want more confidence, or I want to be a better example to my kids, so they'll like be a good human when they grow up, stuff like that.
Yeah, awesome. So tell me, so we'd see people, 1 person an hour, about 45 minutes a visit.
Yeah.
We do a lot of hands-on. We do some needling, do some taping occasionally. We do a bunch of different things. Yeah. Right. Mostly, even if we're doing exercises, like I got my hands-on person, like put your leg here, do this. So now that it's been pretty much since Monday that we've been doing. We've basically said, because at the time of this recording, it's March 27th. So in North Carolina, the governor what was it, 3 days ago, sort of implemented the stay-at-home, was it the stay, no, it wasn't a stay-at-home order, it was something else order. But anyways,
so
we could, as of, I'm trying to get my timeline right, I think it was as of earlier this week, Wednesday, we couldn't do massage therapy.
Yes.
But at the beginning of the week, we had already said we can't do massage, we weren't going to do massage therapy. And we could still be doing physical therapy, but Andra and I kind of came to the conclusion Sunday night that like we shouldn't be doing massage and we should probably be moving to telehealth just even to give us some breathing room to figure out what's going to happen.
Yeah.
Because I just got off 10 days of trying to pivot PT BizCon, and it was like all of a sudden Sunday night. So we've moved to almost all telehealth. A week and a half ago, we already had Zoom set up, and we knew it was going in this direction. We got to the end of this week, and I think we basically had one person not want to do their appointment this week, or maybe two. Monday, I think we had people move from Monday to later in the week because they had work meetings. Right?
Yeah, that was. Oh wait, no, that was last week.
Was that last week already?
Yeah.
Oh
so
my God, my brain.
Last Monday. Yeah, I'll give you the preview time.
Yeah.
Last Monday, a lot of people. That's kind of when everyone was like, "Oh crap, COVID's actually a thing in the U.S. We actually should be worried." So a lot of companies were freaking out, and everybody got stuck in meetings. So everybody moved from Monday to Friday.
That was last week, okay, yeah.
Then this Monday, the governor announced that all of the gyms, hair salons, massage therapy places all had to close on Wednesday.
Yeah.
And then like Tuesday night, Wednesday morning is when they're like, okay, stay at home order for Friday.
Okay, good. So we've almost been ahead of it a little bit. Partly that's Andra's intuition is really strong. She really knows what we should be doing.
She's so in tune.
And she was like, Aaron, you need to move the PT BizCon to like a virtual something. You need to do, and I was like, you're right, I just don't want to make these some of the hardest decisions I've had to make in years.
Yeah.
But getting to the end of this week and not having there's clinics out there that are like, we've shut the doors, we're closed, have laid off staff, businesses have laid off people. Mm-hmm. What did you do this week? What was the conversation like you had with patients? What was and then like how did we keep people on the schedule? Like what was how did that work? I want people to know because this episode's going to go out in 7 days, and so it's going to be right where people need it. Yeah. So what is it that you said to our patients, and how'd that conversation go? What was that process like for you?
So a lot of it was on like a case-by-case basis, and we definitely changed a lot throughout the week. So at first, because everything was rolling out so soon, Amber, our front desk staff, was just emailing people basically for just the very next day, because that's all we had, because my week was really front-loaded this week. I would say a lot of our monthly membership people, so all our wellness warriors, were perfectly okay with it. They didn't care. They're like, we know Kaitlin's good, it's fine. Yeah. A lot of our newer clients were kind of skeptical at first, so the phrasing that Amber would use on the phone with them is, let's just use today as like a test trial run, just to make sure you have connectivity, and then Dr. Kaitlin will just like give you an overview of what your treatment session will look like. If you want to like continue treatment, if you're already connected, that's great, you guys can talk about that, or you can just reschedule for later in the week and we'll give you that full appointment. So with one person, they were pretty cool with it, and they were really skeptical at first. So I was like, listen, let's do half hour this week, we'll do a half hour next week, and call it one, visit. And she was like,
she had paid in full, I think, right? Was this person?
Yeah, she had paid in full.
Yeah,
so she had paid in full, and she was just skeptical, and so she was like, okay, we'll do that. So I treated her for a half hour, and a lot of it was just, hey, we're gonna move where you're putting the ball for self MFR, and here's a couple exercises. And at the end she was like, wow, that was actually a lot more helpful than I thought. So I think a lot of people, just because of our society, think PTs need to touch people to make them heal, so patients kind of have that preconceived notion coming in. So that's kind of why they give pushback. And then another reason why I think they give pushback is just like, there's so much change happening, and this is just another thing that they can't control. So a lot of times, like, just jumping on the phone with patients and letting them feel heard, and just like reassuring them like, it's okay, we can still do this, I hear you, I understand you, let's just like give this a try, bear with me, and we'll take it week by week. So that's another phrase we've been using a lot is, hey, we'll take it week by week just to like assure them.
Right.
And then actually some patients were actually really cool with it and they suggested it. So I had someone last week who she couldn't make it into the office on Friday because of meetings and just how hectic everything was, and she was like, I know I don't want to leave my house, can we do video visit next week? And I was like, sure, all right, awesome. And she wanted to see me twice via video visit, so.
Awesome.
Yeah.
We had any pushback on price?
No, not once has price been mentioned. Yeah. The only pushback we got was because like we've had chronic pain people who they feel very confident in their like self-treatment toolbox and they're like, I already have a lot of exercises. So with those people, I just hop on the phone with them. I'm just like, hey, how are you feeling? Let's check in. You know, as long as you're maintaining your progress, okay, that's great. We'll see you when this is all over.
Right.
But if you do backslide, we'll just jump on a video visit. And this is how like it would work and what it would look like.
Yeah.
But those are people who've been here for like 2 years.
Yeah.
A lot of years.
Multiple years, and then over the course of like
issues.
10 years, multiple issues over since I was downtown doing massage therapy, basically. So 10, 12 years or so. So tell me about what are some of the things you do on the visits, like in these video visits, like what are you doing? Is it, because you can't reach through the screen.
Yeah.
Right, so how does that go? What does that look like for you?
Yeah, so a lot of the time I'll just start with top tier and see kind of what is going on. A lot of the times I don't break it out because it's just a lot harder, because the only difference, you can only do so much with them stabilizing the motion.
Right.
So it'd be hard to do an eval that way. I could still make it work, I just haven't had to. But usually with knowing what's going on with their case and the top tier, I can usually figure out, okay, we'll just do this. So a lot of them, I'll have them use the ball for self-myofascial release, and I'll just talk them through it. And a lot of them have said that like it's more helpful when I talk them through it than when they do it at home by themselves, because I coach them through, hey, you're gonna breathe, and then I ask them like, oh, what are you feeling in your body? And they constantly have to be aware of how they're feeling, because I think a lot of us just tune out how we feel day to day. And then actually make them stay on there for the full time. So I think people just get impatient and they hop off the ball. Because I had one kid, I was like, okay, show, because sometimes I'll coach them through and I'm saying, this is where we're putting blah, blah, blah. I had one patient who I was like, show me how you use the ball. And he was only on there for like a minute before he's like looking out the window, you know, like getting bored and about to get up. And I'm like, no, 5 minutes. So that's usually what we start with. A lot of patients have been great though, and they'll call their significant over or their partner and they're like, here, just press where my PT tells you to press. So we do that, and it's really cool to see like, oh, this is what your home is like. This is your support system, your animals. I get to see all that, so it's kind of cool. And then after that, we go over exercise. So a lot of them, it's just hard because I can't physically put hands on them. So a lot of it is being a little bit more patient with patients and being patient with yourself, because you also have to be a lot more descriptive. So like, for example, if they're doing like a bird dog, I have to verbally like explain it versus like, oh, here, just I'll move your arm or just watch me do it. Because if I mean, sometimes I'll say watch me, but then I have to move my whole camera setup and it doesn't really work as well. So I think it takes longer to get stuff accomplished via a video visit, but I've also found that it's like more effective because they're more in tune with their bodies and they're actually paying attention a little bit more.
They have to do more of the work.
Yes, I think that's what it is. They have to do more of the work. So we'll do a couple exercises, and then at the end I'll just kind of recap, and then usually I'll record at the very end. I'll be like, okay, just so you're aware of what you're doing, I'm going to press record. Just watch me go through everything you're doing at home, and then I'll send you the recording. And I'll just do like a quick little 2 or 3 minute clip, and then email it to them.
Awesome.
Yeah.
Really cool. That's great. And then yesterday we shipped out a bunch of stuff to people.
All our Wellness Warriors, they loved it. Some of them we've been implementing their stuff in their treatment plan. Other ones, you already have like, we sent one of them the R8 roller. And so I sent them your YouTube link of like, here's how to use it, because they just like new tools. So,
What else? So tell people like, what did we send them? What did we ship? What did we do?
Ooh, let's see. So based on, I kind of know what's going on with them. So, and I know what they do and don't have. So the people that we sent the R8 roller to, they'd been eyeing it up for their birthday, and their significant other didn't listen to them. So we sent it to them. A lot of them, that I know that I use dry needling with, I sent them the rumble roller because I find that it's just hard and a lot more pressure than what they're used to and more than the ball.
Right.
So they enjoyed that. We sent everybody new t-shirts that we got, clinic t-shirts, new clinic water bottle, and then some of them I sent some of like the loop bands, K-tape, rock sauce, depending on if I know if they tape a lot or not. So,
awesome.
And then I'll customize thank you card.
Oh, cool.
So, yeah.
Oh, that's great. And these were people, because I don't make sure everyone listening got this. What kind of patients are these?
So these are our wellness warriors who, if they like value what we do, so I wouldn't even call it like a maintenance. Some people are on it for maintenance. Other people are more performance people, and they just want to continue to perform at their best in yoga, running, whatever sport they do. They just come once a month. It's like an auto draft membership.
Mm-hmm.
So they get one PT visit a month and then 20% off of PT or any of our other wellness services.
Right.
And then they get like priority scheduling, unlimited access to me via like email, phone.
Mm-hmm. And why do we do all this?
Because we want them to stay with us. Because even though like we were kind of, I don't know, were you unsure if they would see the value of video when we first rolled out the care packages?
It's that these people aren't, they don't have an immediate acute need for physical therapy, right?
Yeah.
They love us. So one of the, what's it called? The instincts that a lot of people have is when something like this has, or even back in 2004 when I had my massage therapy practice, all of a sudden everyone said, I was in San Francisco, the .com thing crashed, and I was like, Aaron, $80 is too much for massage. I'm like, what do you mean $80 is too much? Yeah. So I was like, all right, how about 75? And then at 75, in like November 2003 maybe, I moved to $75 and I had no more objections. And that was my first lessons in price, in like pricing strategy, because it was only a few bucks less. So the first instinct people have is to like slash the prices, cut the prices, because I don't value it as a therapist because I can't touch you. So obviously you're not going to value me. And so my thought was like, yeah, I was a little worried, but I also wanted to know, okay, we've got these resources. Instead of lowering prices, how do we over deliver for people in a time when they need us the most?
Yeah.
Right? They need to know that they're valued. And that was, hey, we've got this new design that we've got. Let's go ahead and get the t-shirts made. Let's give them something that we have that's valued. If the rumble roller costs us $25, but the retail value is $45 or $50, say we're giving you a $50 thing. It doesn't cost me $50, but now I can deliver $50 or more of value plus the thoughtfulness that comes with it.
Well, it's crazy that you say that because I had one of our Wellness Warrior members last night, and we had just had, so he normally shows up about like 15 minutes late to his appointment because of work. So of course he was late to our Zoom meeting, and then we had some technical difficulties, so like I probably only had like 30 minutes with him. Yeah. And I gave him the option. I was like, hey, we can use this as a trial basis. I'll talk to you for like 30 minutes and we'll do 30 minutes next week. And he's like, don't even worry about it. I don't care about the price. Let's just get what we can get done today and it's fine. And so he was cool with it.
Yeah,
so
that's awesome.
He sees the value.
Yeah. So that's the whole thing with those, is like, how do we deliver more value? How do we deliver more value for our community? That's why we're doing, we're trying to get these workshops in at like Burn Boot Camp and CrossFit. Like, how do we give more value to other businesses that have memberships whose members are not only our potential patients, but who we can help in some way, and we can help keep value here in Greensboro. And that's really the whole, like, that's the abundant strategy rather than the contraction scarcity strategy that a lot of people find themselves in right now.
Yeah, the same patient mentioned, or actually, sorry, different wellness warrior is also seeing a chiropractor too, and he was like, yeah, the chiropractor said he's kind of scared because like if they make him close, there's that, or he said that his services are one of the first to like get slashed, so he's trying to see everybody like now. Right.
Yeah. It's like, how do we keep it? So how do we keep it so that we're still valuable to people? Because we have problems to solve. Over deliver and figure out what it is that we can do that they need.
That's the other thing, figuring out what they need, listening to them enough to figure out what do you actually want and need.
Right. What, let's see, so tell me a little bit about, during your visits, if you feel like you need to, touch someone somewhere or move something, or when you would have done some MFR or needling, what do you do? Like, what are you doing? How are you accomplishing the same effect or outcome?
I would say like being creative. So I had one patient today who she's a yogi, really bendy, but she has trouble with hip rotation. And like normally when I work on her, we're working on like obturator internus, right? Yeah, obturator internus and glute med a lot. But she wasn't really getting the pressure with the ball because she's really good about self-care. So we had sent her the rumble roller. So I had her get into pigeon and sit on the rumble roller and do that, and then use rumble roller on like her TFL, and her hip rotation improved like dramatically. Yeah. So it's like being creative. Like when in the world would you think to get someone in pigeon pose and have them sit on a rumble roller? Yeah, but that got the spot. Yeah. So it's just being creative in their body placement to help them find like the spot.
Yeah. Yeah. Really cool. So I guess what's the next question?
What's the next question?
What's the next question about like the telehealth thing? I think where do you see that going and fitting in our practice in the future?
So I definitely want to like implement it, and it's kind of interesting. I think I kind of alluded to this before, but like I guess new patients are really skeptical of it versus like the older patients aren't as much, which I find I don't know really what to make of that, but I think it's like one, there might be like a mindset shift of, oh, a PT doesn't need to touch me to help me, which I think is like an important message to get out there, because I think sometimes that can also lead into like that chronic pain cycle of, oh, I need someone to touch me to feel better, therefore I need someone to touch me for like the rest of my life. Right. So it'll be interesting to like see how that plays out, but I definitely do want to use like the video service for like people who, one, don't need hands-on, and they're more performance, because that's pretty easy to do, or people that are just like really busy in life and they just don't want to come into the clinic, and that's perfectly okay. Like maybe someone needs help on their lunch break. Instead of driving to the clinic, that eats up like 10 minutes, and driving back from the clinic, and then all of the time like they could just hop on a Zoom call with me, or Intake Q has their new thing, so if we switch that, we can use that. But seeing people over like a lunch break, or people that are long distance. So a lot of times we'll have people from other parts of North Carolina like come, and then they'll kind of drop off the schedule because they like didn't know that we offered it as a service. So they just thought, oh, I can't see my PT until I come back. Or we have a lot of snowbirds that go to Florida. So we could hopefully, like, I would want to teach them in the clinic how to utilize it. Right. But then like when they go to Florida, I can still see them like over the winter until they come back. Yeah. Yeah. Awesome. That's so cool. Yeah. Yeah, that was one thing that I never considered. I know, I didn't even think about it, yeah.
Yeah, I was like, no, I use my hands. It's not physical therapy if I'm not touching people. I mean, I know it's not. I know it is, because it's critical thinking. Yeah. That's one thing that I think it goes back to when people send us the referral for the physical therapy. I think that was right before you started working. We had a referral. I was told I needed the physical therapy.
That's so bad.
Oh my gosh. But it's one of those things that, it's like, well, is it really physical therapy if I'm not touching you? Yeah. I've been talking to my friends for years over the phone, helping them with their hips, backs, knees, calves, etc. And is it physical therapy? Well, not to insurance.
Or are you just a personal trainer that knows a lot?
I'm a personal trainer. Yeah. So, nowadays it's going to change, but is it physical? I mean, that's the big question we have to ask ourselves is, when is it physical therapy and when is it not? When is it never not physical therapist when you're a physical therapist?
Ooh, to me, it's more like assessment. I think like the assessment is all in it. Because I don't remember if I was having this conversation with you. Or no, I think I posted about it. Yeah. Where it's just like every single visit I'm assessing you. So it's like that's why it's PT, is because I have to use assessment, not because I'm like laying hands on you. Because maybe your personal trainer thought you couldn't get your arm overhead because your lats are tight, but oh no, you can't get your arms overhead because your T-spine's tight, and that's like when it's PT.
Right. It's the critical thinking.
Yeah,
that's what
critical
I thought.
Thinking. Yeah.
If I have to do critical thinking about how your body moves, it's PT.
Yeah.
Doesn't mean I'm always billing for PT.
But you don't have to worry about that.
We don't have to worry about that.
Yeah. That's why you started this.
Right. I will say though that in telehealth, in regards to telehealth, if I'm doing physical therapy with someone who lives in a state, just if you're watching this and this is the first time you've heard of telehealth, if the rule is right now that if the patient is in California and I'm not licensed in California, I can't do physical therapy with them in California.
Yes.
Okay, it means I can't file a claim. I can't call it physical therapy. I'm not protected under my physical therapy liability insurance. If I'm if I'm telling them this is physical therapy, but there's also now there's a compact, a state compact. I think it's 28 states or so. North Carolina is one of them. I just looked that up
because someone in Georgia asked me to treat them as PT, and I was like, I can give you remote coaching, but I can't do PT because Georgia is like, we're gonna do it, but they haven't enacted it.
They haven't done it yet, and that's something that once we catch our breath, we should probably just go ahead and figure out how to do. Yeah. And when it comes to cash-based physical therapy, it's one of those things where even in our clinic here, patients that are filing claims, they're not getting reimbursed. And so there's a gray line there. And for anyone listening, if you feel like it's gray or unclear, you got to get clear on what you believe is physical therapy, what you are telling people you're charging for or providing. It was explained to me a long time ago when I called the North Carolina Physical Therapy Board, and I spoke to them, and I asked them, because everyone's saying, oh, well, there's this myth that you're held to your highest license. Well, what the hell is your highest license? And I don't know if you've seen this anywhere, but in North Carolina, massage therapists, physical therapists, occupational therapists, physicians, dentists, chiropractors, acupuncturists, etc., we're all licensed in the same bill. So there's not one piece of legislation that's more important than the other. We're all in the same bill, and the bill can be amended. And it has nothing to do with my schooling. Like which school gave me the more established educational degree, right?
Like your bachelor's versus your doctorate,
Right, or a certificate in massage therapy. It's what service I'm holding myself out to provide. So if I tell you I'm providing physical therapy, but I'm really providing massage, or if I say I'm providing massage therapy but I do physical therapy, it's my skills are the same. And massage therapy, PT, I can do a lot of the same things, but I can't manipulate as a massage therapist. I can't dry needle as a massage therapist, but as a massage therapist, I can do internal massage trigger point therapy for pelvic floor problems in North Carolina if there's a physician's prescription. So there's a lot of overlap. It's what am I telling people that I'm providing? That's the big one. What do they understand? And that's why our consent forms and all those things are important. So I just want to make sure that we got that legal mumbo jumbo out of the way.
Well, then it brings in the more nuance of like, is it where they reside or where they're living? Because like for our snowbirds, their permanent address is going to be North Carolina, but they're just like staying in Florida.
As of last week or 2 weeks ago, it's where where they are at that moment.
Oh, okay.
So if I am a in-network clinic and I'm filing insurance claims and they are in Florida and I'm not licensed in Florida, then I can't file an insurance claim for a physical therapy visit where they were present in Florida.
Okay.
Yeah.
That's crazy. Because also, there's definitely a lot of other clinics I've seen. Like my friends' clinics now aren't even billing for their telehealth visits because they like can't figure out how to basically.
Right. And that's changing day to day right now as we're recording this.
Yeah.
You know, North Carolina Blue Cross Blue Shield, North Carolina has said that they will allow telehealth. So I would say if you're listening to this and the freaking out about the legalities or keeping you from serving your patients, serve your patients first, figure out the legal ramifications, and work with the healthcare lawyer.
Definitely.
That's what we do. All I do is call
pay the people what their job is.
Right? Right?
Get a pro.
Okay, so I think those are the main pieces I wanted to ask about. Let me ask you one more question.
Okay.
Where do you think we're going as a profession in physical therapy?
Like I said, I think it'll be interesting whether we move forward with the we don't need to touch you mentality, because there's like a big push for that, and also how much of that just stays in the PT profession versus how much of that like gets into like general public knowledge.
Right.
So I definitely think we are moving in like an online direction, but I also think like we're moving so fast, and kind of like what you said, like legal and I guess billing can't even like keep up with how fast we're moving.
Right.
But like you have to, when you put the system under stress, it has to change and adapt, because people still need help even though they can't come see us in person.
Yep.
And it's kind of like I saw, I guess it's not a meme, but just a picture floating around online of like how we started in the polio epidemic, and it's like, okay, that's how our profession evolved. Like, how how are we going to respond to COVID, and how are we going to help all these people that still need help, but deliver it in a different way.
Right. Awesome.
Yeah.
Where do you see yourself in 5 years?
5 years.
What are your 5-year goals?
Ooh, I want to be like a hybrid PT. So I kind of want to be treating like part-time in person, doing like leadership, management, or education part-time, and then doing like online consulting for powerlifters, strength athletes, and CrossFitters.
Awesome.
Yeah, do all the things. I want to do all the things part-time. It's fine.
Yeah, that's cool. That's what I do.
Exactly.
Well, what's part-time? What's full-time?
Exactly.
Is 40 hours in one thing full-time? Like, I would never treat patients 40 hours a week.
We talked about this at my 1 year. I was like, yeah, you can, for some people, they want to work more than 40 hours a week. Other people want to work less.
Right.
Just do what makes you happy.
Yeah, that's awesome.
Yeah, do what fulfills you.
Is there anything else you want to share? Is there a question I didn't ask that I should have asked?
I don't think so.
Okay.
Have you ever treated via video? Because I know you said phone, but have you ever used this video?
Yeah, a friend of mine.
What did you think? Or how
did you? I mean, it was one of those things where we got on. I think it was before Zoom, so we got on like Skype or FaceTime.
Yes.
And it was like, all right, let me see. I needed to see him. Like, okay, stand up, stand on your toes. You know, let me see how much you can move. And it was more about talk. Here's the thing. Just someone telling me what the problem is, I usually know where the problem is.
Exactly.
You know, it's pattern recognition. So I don't need to see much or touch too much to help people. And I think I got to a point where I was like, here, you're going to do this. You use this ball, do these things, do this exercise. And then if it's a problem, call me back. If it's still a problem after a few times, then we'll get you to a local PT. I've done that with a couple people. You know, a friend in New York, a friend in California, sister-in-law, and one of Andre's cousins, you know, help, and I'm sure a few other people I've helped. And that's how a lot of my blog posts and Back Being ebook were written, were from the emails of all the things, the top 5 things I always tell people to do when they say, hey, Aaron, my back's hurting and I live in California. Well, that's what my Back Being ebook is all about. And the videos I've made, I've treated more people through video than I have in person. Because my videos have hundreds of thousands of views on YouTube.
Yeah.
Right? My video on using a ball, I think has 230,000 views or something crazy like that.
Yeah.
It's a lot.
It's crazy, yeah.
It's a lot. And so people write on there all the time, Dr. LeBauer, you know, this has helped me more than anyone else has ever helped. And it's just a video. And it's a one-way video. So just imagine the power of a two-way video.
Yeah.
Personalized. It can be really powerful. So, I think there's a lot of hope for us. It just may not always be hands-on. Hands-on's great, but it's you have to keep your body in shape and fit to do a lot of hands-on work too, right?
Yeah, I just was talking to a PT friend yesterday, and he was like, he's a year out more than I am, so he's 2 years out, and he was like, yeah, my hands already hurt, and he's like, I have tools now, so I don't even use my hands. He's like, I just use the knobby thing and poke them.
Yeah.
So yeah.
I don't like that as much. It's no connection.
No connection.
Yeah, very little or less connection, but
it's true.
That's just me. I started as a massage therapist.
So interesting, yeah. And then us PTs started, no, we're not going to touch anybody.
Right. Yeah. No, that was the thing. I got in PT and they were like, oh, we don't touch people. I'm like, what? They're like, yeah, 30, 45 seconds is all people need. I'm like, people have come to me as massage therapists for years because they don't get touched by PTs.
Yeah. No, my shoulder PT, when I went for powerlifting, in my eval, didn't touch my shoulder in 8 weeks of PT. And what do you know? As soon as I pick up a barbell again, it hurt.
Yeah. Do you think if he had done something where you were able to replicate where the pain was, using a ball or something, even if they didn't touch it, you know, what I hear that they didn't really do was get you to know that they knew where the pain was. That was one of the things, right? I mean, one of the
but I think also like they just assumed that I had like, I don't know, shoulder instability.
Yeah.
Which wasn't the problem because you said my problem is T-spine extension rotation, which it is, and I've been working on it. But that's why obviously like after they didn't have me lift anything upper body for 8 weeks, and then we're like, okay, you've passed PT, you've done all your Y's, I's, T's, and all your shoulder throw things. You can go lift a barbell now. And then as soon as I weighted it, it hurt. So. Yeah.
So that's interesting. Here's the thing that I was almost getting at, but I'm just going to tell you.
Just tell me.
Bob Duvall, who we both worked with.
Yeah.
And he told me, I mean, I learned some amazing things working with him through his PT school. He said people need to have their affective needs met.
Oh yeah, he would tell us that too. Yeah.
Right? They need to know we know where they hurt.
Yep.
You know, and it's true. And it's like, gosh, if it's like even through video, can I get someone to press on the thing or lay on a ball on the thing so that I'm like, they're like, yeah, that's the spot. Okay, great. I know where the problem is.
Yep.
You know, and we can do that. You know,
Which people need it.
that's what people need.
Yeah.
All right. Well, thank you very much.
Thank you.
It's awesome working with you for
It's
over a year.
awesome. Yay.
Yeah, I'm glad you're on the podcast.
I would fist bump, but I don't even think this is 6 feet, Aaron. We need to be farther apart.
We are not 6 feet apart. But we've been in this building for a couple weeks, so
Yeah.
I mean, I don't know if we have the same kind of filters that they have in the hospital in here.
No. We do not, but it's fine. We'll be fine. We're gonna make it out.
We're gonna make it. So
We're gonna help lots of people and make it.
Yeah,
Yeah.
we're gonna help lots of people and make it. You know, and I think that's one of the things that I want to leave you guys with is that if it was just me here, I don't know if today I'd be seeing people who absolutely needed me to avoid sending them to the ER, but we don't get those people in our clinic anyways.
Mm-hmm.
But I'm here for people, and that's what we're doing. We're here for people. We're here for patients. Be there for your patients, and you'll get through it. We're stronger together.
Strong together.
We'll see you on the next episode of the CashPT Lunch Hour. Peace.